suffer from lower back pain? Poor lifestyle choices like smoking, lack of regular exercise, bad food habits, incorrect posture, and many others may be to blame. The pain you feel in your back is most oftentimes caused by having what's known as a slip disc. A slip disc is basically a bulge on one of the discs that are between the tiny vertebrae in your back. Poor lifestyle choices and back trauma are the primary reasons for this condition. When the disc bulges out far enough to press on the nerve, it causes pain, sometimes more severe than others. Pain radiating to the hips, back of the knee, heel, and toes are all pretty common. If you're suffering from lower back pain, the bottom line is that you just cannot neglect it any longer. Good chiropractic care will help you finally find the relief you need and live the pain-free life you deserve. We have years of experience and thousands of satisfied patients. We would love to reduce your pain and have you be our next happy patient. Contact us today.
Alright, so tell me please, what's going on with you?
Well, the main thing that I've been carrying on with is that I've been having lower back problems.
Are you pointing at the right side, right?
Well, it's generally sometimes it hurts right in the middle, and then I don't know if that I gotta do something, because sometimes I feel like my butt cheek hurts, and I sometimes it's both of the sides, and I kind of, when I step on it, it hurts.
Okay.
All the way through from the bottom to the top, and it feels like I lose strength on my feet.
Okay. Does it travel? The pain travels below your knee or no?
Sometimes it is below
Okay.
me.
Does it go all the way down to your toe?
Only to my heel.
Sole? Okay. Okay. 0.
And then another thing that it popped out recently is that this knee is kind of swollen, and I have something like a little ball right here, and it gives me problems to bend my knee all the way.
Okay. Did you hurt? You play football?
I think what happened is that I was working for stand up too much for a long period, and I bent my knee, and then the next day after that I couldn't bend, or if it would hurt to bend my knee, it was kind of.
Well, I see. You play football? Not soccer.
Not
Come on, it's called football everywhere in the world.
Yeah.
We only call it here. I'm from Eastern Europe, so.
Yeah, we call it football, right? Yeah.
Do you play?
I used to not no more.
Not anymore.
Yeah, because of my. Yeah.
Okay. All right. So let me just write this down. Anything else? Did you have any injuries, falling, or anything else?
Not that I know, just that.
What's the level of pain in your low back, 1 to 10?
I'll say 9.
9?
Yeah, 9, 10.
And the knee, the left knee?
Well, it's when the knee will be probably a 6, 7. Sometimes it doesn't hurt, but when it hurts, it's kind of hard to bend it.
Did you get any kind of care?
I did went to the doctor, and he gave me some anti-inflammatories.
Yeah, but the dog doesn't know anything. Yeah, typical story.
Yeah.
Okay, it works for a little bit while you're taking it, and once it's out.
But the weird thing is that I took the whole medication, the whole process, and never never swallowed it, because it was still all swallowed. You can tell the difference. Right now I'm not wearing shorts, but when I wear shorts, you can tell the difference.
Left knee is swollen?
Yeah.
Okay. Well, a lot of times, well, let me see what's going on before I explain to you what's going on with you. Did you ever see a chiropractor before?
No.
No? Okay. Bend forward, please. Back. Forward again. Okay. Okay. Stand up, please. Okay. Face the window. March in place. 1, 2. Stop. Have a seat. Hold this. Be right back. Okay, so this is your spine, and what's happening is that the right sacroiliac joint, which is right here, this side, is about 2 inches lower than the left side, so it's bent like this. So when this happens, the rest of the spine is compensating. So your lumbar spine doesn't have any range of motion on the right side. So you see all these nerves that come out from the spine, they go down your leg. So every time you put pressure on this, it's pulling the nerve, and that's what's causing the pain, and you're shooting pain down the leg. Okay, makes sense?
Yeah, it does.
And these nerves, they go under your buttock right here, so that's why you experience this buttock.
They're like a needle inside.
Yes, it's a nerve being irritated, and that's what's causing this irritating
pain,
buttock pain, right? So and then what's happening is that we need to adjust you here, adjust your middle back because it's compensating. Your left shoulder is about 1 inch higher than the right one, and then your right is about 1/2 inch higher than the left one. And so the neck doesn't have much range of motion too. When the reason why I have the knee pain most likely is because when the pelvis is misaligned, one leg becomes longer, one leg becomes shorter. So the longer leg is basically the one that's you put more pressure because it's longer, so you put thousands and thousands of pounds more pressure on one leg versus the other, and as a result, over the longer period of time, you start creating pain in your hip, knee, or your ankle. Okay, so in your particular case, it's a knee. So once we fix this here, we'll be able to relieve some pressure from your knee. The fact that you have a ball, you say you have a ball right here behind the knee.
You can feel it right here.
Yeah, most likely it's popliteus muscle. So basically, what it is that we need to work on that too, massage it and kind of like bring it down. To alleviate this tightness. Yeah, so we need to massage it. My massage therapist will do it, okay? And on the knee. And so if we do that and realign your spine, your symptoms theoretically should be going away, okay? You shouldn't experience this kind of problem at your age. Okay?
I know, that's my main concern.
It's too young to have these kind of problems. So with that being said, so basically what you're gonna do, I'm gonna set you up for hit and stim. That's gonna help you to relax your muscles. Then I'm gonna adjust you, and then after adjustment, I will send you to my massage therapist, and she's gonna work on everything that needs to be worked on. Okay?
Okay.
Before we move forward, do you have any questions?
I do not have questions, but I have one concern. When I was little, my mom told me that I have like, I don't know what's it called, but like the flat feet.
Flat feet?
Yeah. She said she never like give it importance to it. But one time I went, not with a chiropractor, but with another type of doctor, and he said my feet were fine. He said that I didn't have that problem no more. I don't know if that...
If you were able to play football for a long time, you don't have flat feet because you can't run with flat feet. It's gonna hurt because flat feet basically the reason why you have arch in your feet. So when every time you run, there is like a spring loading mechanism, so it's kind of springs back. So if you play football, you have to run constantly.
Yeah, and I used to run a lot. I would like say like 3-4 miles a day when I was like 17. So yeah, I think that.
Yeah. So let's focus on things that we have here. So it's not related to what you have right now. Okay. Any other questions?
No.
Alright.
I got it. I think I got everything.
Yeah.
You say fall asleep?
No, almost.
Almost fall asleep?
Almost.
That's what we want. Okay, keep your head down. Just relax. So you've never been to a chiropractor before, right?
No, I haven't.
Okay. Alright, so just follow my instructions, okay? And what I'm going to be telling you. Take a deep breath in. Out. Okay, breath in. Out. Okay, breath in. Out. Okay. Go on your side, face me please. Like you sleep on your side. Leg like this. Sit up, please. Put your feet down. Okay, give me this. This goes here. It's down. Lean back. Relax. That's a big noise. Alright. Go back and lie on your side this way. Face me. Keep this leg straight. This straight. This goes like this. Give me a hand. Relax. Relax your shoulder. There we go. Okay. Stand on your feet. How's it feel?
Feels good.
Feels good?
Yeah.
And sit down. Less strain.
It feels good.
Feels good?
Yeah.
Alright. Well, this is just one visit. Cool. So let's go. I'll send you to my massage therapist. Okay?